My name is Dr. Hannah Bradwell, and I'm going to present our paper on the implementation of virtual reality motivated physical activity via omnidirectional treadmill in a supported living facility for older adults, a mixed methods evaluation. And I'd just like to acknowledge our funders and the projects and universities that were involved in supporting with this study. And you can see their logos at the bottom of the screen there. So in terms of the context, we know that worldwide we have an aging population. So more and more of our population is of retirement age and above. And with the increasing age, we see an associated increasing prevalence of illness, ill health, disability, dementia, and frailty. And this puts increasing pressure on the health and social care sector as more people require support and require treatments. Now, this challenge is exacerbated by the fact that we actually have less and less people working in the health and social care sector. So we have a smaller workforce trying to respond to the increasing demand for health and social care resources. So this is why technology is expected to play a role in helping us meet this need. And VR is one technology of interest in helping support older adults with healthy aging. Now, VR has potential for increasing our access to heritage. Now, older adults are particularly invested in heritage, and access to heritage or historical or cultural content is actually a human right with documented health benefits, such as increasing our connectivity to places and spaces and to history and to each other, and supporting with reminiscence. And we're also looking at the use of VR as a potential to motivate increased physical activity. Now, we know that physical activity is essential for healthy aging in helping reduce the risk of many illnesses and diseases such as cardiovascular disease, and ultimately supporting with reducing mortality and increasing our chances of healthy aging. So anything we can do to help motivate people to be more physically active as they age is going to be a bonus. So our methodology. So we wanted to trial the use of the Motus VR treadmill. So this is an omnidirectional treadmill from the company Motus, and also a separate VR experience, static VR experience within a residential home for older adults. So we had 3 research aims. The first was to explore the physical abilities that are required to make use of the Motus treadmill, and also the static VR experience. So we wanted to look at what physical capabilities did people need to have to be able to safely and comfortably use that treadmill in terms of their mobility or their health limitations. For those who could use both technologies, we wanted to look at the user experience, the feasibility and the acceptability of the devices, and also document use and impact. We additionally wanted to document and report on the implementation process itself and any barriers encountered, which will be of use to other researchers or technology developers or people working in aged care settings who might be looking at this kind of technology. In terms of our design, this was a mixed methods implementation and evaluation study. This was preliminary work because we had a small sample size and one site, but ultimately we really wanted to look at understanding the potential use of this kind of technology, and particularly the suitability, so the range of people that might be able to use this type of technology. Who might this be useful for within aged care settings? We also wanted to look at participant experience in using the technology, their perceptions on suitability, and also the design of the technology, so that we could feed this information back to the technology developers and it would be of use to other developers in the sector. So our materials. So we have the Motus Adventure Omnidirectional Treadmill, as I mentioned, which you can see on the top on the right-hand side there. So that involves a plastic dish at the bottom on which is applied a thin layer of lubricant. And then the participant is able to stand inside that dish and inside the safety rail. And as they move their feet, then they move around a virtual environment. And to do that, they wear the shoes that you can see on the bottom right of the screen there, and they have these ceramic plates on the bottom to help with that low friction. So the participants' feet glide across that omnidirectional treadmill and they can move in any direction. And as they do so, they move through a range of different virtual reality environments that Motus built into the system. And these included heritage sites, real heritage sites that might have been local to the older adults, and also gamified heritage sites such as museums that have been created for people to be able to go around and explore. We also had the static Motus Relieve VR experience that you can see in the middle towards the bottom there. So much more common VR technology that most of us have tried, where you just move your head to look around different places. Again, this involved some heritage sites in terms of the content, but also included places like beaches or the countryside or waterfalls that people could sit and relax and look at those kind of settings. This is an example of one of the heritage sites that is included in the standing treadmill. And you can see in the bottom left there, someone who is standing on the treadmill, and they are able to move around and navigate around this environment. So the thought is that as people want to explore the heritage site, or they want to explore the environment, they would be motivated to move more and walk more so that they could actually achieve that and be able to see more of the virtual reality map. So in terms of our setting, we recruited a supported living facility, and within that setting we had 7 older adults who consented to take part. They all had varying degrees of mobility and independence. We had 1 male and 6 females, and an average age of 79. And as you can see on the right there, our oldest participant was actually 103. So in terms of the health limitations, we had a range of different limitations among the participants who took part, including mobility impairments, short-term memory loss, balance impairments, respiratory issues such as COPD, fractured pelvis, arthritis, new hips. So a range of different impairments that would affect our participants. We also had a wheelchair user and walking stick users participate. In terms of the procedure, on our first visit, we conducted baseline measures of senior fitness tests and also risk of falls. We also conducted a decision tree process to see which of the 2 VR experiences people felt most comfortable to try first, and if they'd be comfortable to try the other one afterwards. Both of the VR technologies were implemented for 6 weeks, and the researchers visited once or twice a week to help facilitate the technology use. The residents kept diaries of their experience following the technology use. We wanted to capture some data during the study to make sure that we didn't wait until the end of the study in case of any memory strain or aggregation. Following the 6 weeks of implementation, we repeated the senior fitness test and the risk of falls, and we also conducted a focus group with the residents and an interview with the site manager. The qualitative results, so the diary, focus group and interview, were then analysed with thematic analysis. So here are some pictures of the residents during the trial, and you can see there some of the residents in the standing treadmill enjoying walking around and exploring virtual environments in the VR. And you can also see some of the residents using the seated version, the static version, where they were able to look around relaxing locations and see different places within the virtual reality. In terms of our results, so one of our key findings was that these devices were suitable across a range of different ages and a range of mobility challenges. So what we can see here was that all of our participants, apart from participant 6, were able to use the standing treadmill. Now, participant 6 is a wheelchair user and was unfortunately unable to use the standing treadmill. But you can see that all of the other participants, even when they have the range of physical mobility and health limitations that we can see in the table, were able to use both technologies. And this is a really interesting outcome that shows that these kind of technologies do have potential to help support physical activity in aged care settings. This is another example of the level of frailty among our participants. So we can see here the senior fitness test results and the risk of fall results, which demonstrate that very few of our participants actually met the fitness cutoff point for senior fitness, and that also many of our participants did meet the criteria for a risk of falls. And so our participants were actually seen as frailer than most older adults within the community. So that really does demonstrate that with this frail group of older adults, the fact that they were able to and enjoyed using the treadmill is a really interesting result. So this demonstrates the thematic analysis of the diary entries and the focus groups and interviews. And there's lots of results in here, but I'll pick out a few, one of which is the perceived benefits. So the residents did report feeling positive about the fact they were able to experience different places and spaces that they weren't able to get to physically anymore. They also really felt that they were being supported in increasing their physical activity. They felt like they were getting exercise and that using the treadmill was quite a workout. They also found that the content in the seated treadmill, the seated VR, was useful for reminiscence and helping with relaxation and new experiences as well. There were some perceived concerns of use, particularly around the standing treadmill in terms of the slipperiness of the dish or any risks of falls. There were some concerns around implementation in terms of the practicality with the cost of the device, with maintenance cost, with the physical space required as well to be able to host something like the VR treadmill. There were some suggested improvements, some related to the practicality, such as it being able to fold for easier storage, the head-mounted display being lighter for the residents, and also suggestions on improvements to the content. Participants particularly liked content that involved nature scenes, the heritage scenes, and being able to access historical places. There were some negative effects noticed with both the seated and standing treadmill that are related to the virtual reality itself. This was unpleasant feelings, a bit of claustrophobia, a bit of vertigo, and feeling travel sick. In terms of user experience, the participants praised the experience. They felt it was immersive and they engaged well with the content. Usability was seen to improve over time as people got more confident and were able to practice using the devices. In terms of suitability, interestingly, some of the participants reported that they felt it was more suitable to those participants who were less able. So the participants who were more able and had less mobility impairments actually felt that they would just go out and about and do their physical activity and access these places outside. And it was actually seen in the results that they had used the standing treadmill less. So the participants who used the standing treadmill more did actually have poorer mobility, and it was felt that perhaps because they couldn't go out as easily or as readily, that this did give them an option to be able to access those experiences in those places without going out, and also gave them an option to increase their physical activity, work on their fitness, work on their muscle tone, and do some more walking while remaining in the home. In terms of accessibility and adoption, there was rapid uptake by the residents, and we saw really good acceptability of the device overall. So in terms of the discussion, like I said, there were 6 out of 7 of the residents that were able to use both of the technologies, and all residents tried the seated VR experience. We did see that the VR experience did motivate people. They felt that they were motivated to be more active and to exercise. And so this could be an area of future research to look at in terms of use of these kind of technologies to enhance physical activity and support with healthy aging in aged care settings. We did see that some of our residents felt that these kind of technologies were probably of more use to those less able to go outside. And we also documented some of the design iterations and suggested improvements. One of which that residents were interested in was the use of a seated treadmill. So a treadmill where participants could remain seated and therefore reduce that risk of a fall, but also still move their legs and still move their feet to move around the virtual environments, because they recognized that having the motivation of the VR actually supported them with being active and getting that movement in their legs. Motorists actually responded positively, and they have developed a seated treadmill, which is now being trialled. In terms of the implementation considerations, we did note that there would be a staff resource requirement when implementing these kind of technologies, because there needs to be some support with facilitation and supervision for safe use. Also, as I mentioned, the physical space requirement and the maintenance of these technologies should be considered. Overall, the results of this study have implications for technology developers, researchers, and also stakeholders in aged care settings who might be interested in looking at these kinds of technologies.